Nerves are intricate structures that connect the brain and the spinal cord to different organs and structures in the body, to the heart, the skin, the muscles, the joints, and think of it like a two-way highway and connect signals and information back to the brain and the spinal cord.
So then how do they become injured, and what are some symptoms? How do we know if we have an injured nerve?
The diseases that involve peripheral nerve can be variable. The most common injury or pathology that we see is probably trauma or injury or blunt injuries to the nerve, but you can also have different disease processes, like diabetes can affect the nerves and affect the way they function. You can also have nerve tumors or different metabolic syndromes that can affect the nerves. So it's a very variable disease process that can involve the nerves.
Yeah, there can be so many options for injury there. What's the most common injury?
Common injuries, direct trauma, you have a fracture or a direct compression to the nerve, and that will be the most common type of injury to the nerves.
Once, I've heard of nerve damage before, that maybe sometimes once it's injured, you kind of have numbness, or maybe for the rest of your life. But if a peripheral nerve is injured, there are opportunities for healing, right?
Yeah, the nerves are much better at healing than the central part of the brain. So the nerve heals and regenerates, which is a unique property outside the central nervous system. So that's something that we can actually treat and try to help patients who suffer from it.